is Mrs. Adebukola. I gave birth to my baby, my son, on the 1st of January 2023, and we discovered he couldn't swallow on the 3rd of January, and so we had to take him to the hospital there in Abeokuta. So we were told he's going to be in the nursery for a week before they diagnose anything. So we were there, and they told us the baby is going to undergo a surgery due to chest abnormality. So they referred us to another hospital. So we spent 2 weeks at the hospital. So they wanted to do the surgery there before they referred us to Evercare Hospital due to unavailable of ICU. So we had to come to Evercare. Although I was scared and a bit nervous, but I put my trust and hope in God. So on getting to Evercare here in Lekki, I met with Dr. Arua, and he said I shouldn't be scared, that there will not be problem. There won't be a problem at all. I prayed because he said I should pray, that prayer should be involved, although it's not a new thing. This is not his first time of doing this kind of thing.
My name is Dr. Arua Igwe. I'm a consultant pediatric surgeon at Evercare Hospital Lekki. We met baby Disney last week Thursday. He came to us on referral from an outside facility in Abeokuta with inability to swallow, drooling of saliva, and choking on his own saliva. So when he came, he was already 25 days old, and you can imagine a baby that could not eat for 25 days. He has already lost significant weight from the birth weight of about 3 kg to less than 2 kg. So we had to plan the child for surgery, made a diagnosis of Oesophageal Atresia, which means that there is a congenital disconnection between the upper and lower esophagus. And in his own case, there is an abnormal connection between the lower esophagus and the trachea. So I and a group of surgeons, Dr. Olugbemi, one of my colleagues, a cardiothoracic surgeon, and the neonatal intensive care specialists, and the anesthesiologists and the nurses in the NICU, we managed this child. He had thoracoscopic repair of Oesophageal Atresia the very next day after presentation, and he tolerated the surgery very well.
My name is Dr. Augustine Olugbemi. I'm a consultant cardiothoracic and vascular surgeon here at Evercare Hospital Lekki, Lagos, Nigeria. I spoke to the mother and told the mother, look, we have done about 5 of these cases, and the patients have done well. So the mother discussed with the husband, and as God would have it, they came over to our facility, and the next day we took the patient for surgery. We used a special technique, we call it thoracoscopic repair, where we used very small camera, and put into the chest, and we use very small instruments to do the operation. So what we do is just connect the lower part to the upper part, and then usually it takes about 2 to 3 hours, but this took us about 2.5 hours. The baby did very well. We had to connect the baby to a breathing machine, which helped the child to breathe for about 3 hours before the tube was removed, and then the baby did well.
On getting here, he read the referral letter, and he said the baby has an esophageal atresia, and this is not his first time of doing such. So the baby will undergo a surgery. So we got here last week Thursday, and Dr. Arua and his team did the surgery, and it was a successful one, and that got me very happy. I'm happy right now. After the surgery, he was taken to the NICU, and from there I've seen improvement in my baby, because whenever my baby wanted to swallow, right from the birth date, he's going to start coughing, he won't be able to swallow, but now he's sucking very well, he's latching very well, and he's healthier than the way I brought him.
I'm Dr. Lakmeel Kannachamkandy, who is the consultant neonatologist involved in treating Disney here in Evercare Hospital Lekki. About Disney, I would say he came on the right time and the right place, and he was treated with laparoscopic tracheoesophageal fistula corrective surgery. On the second day of admission, we did this surgery, and his post-op was relatively uneventful, and we gave him all the supports in terms of respiratory as well as other nutritive supports in terms of total parental nutrition. As per planned, he was able to get discharged with no major complications.
The 5th day after the operation, the baby had a procedure, an investigation, called it barium swallow. The baby swallows something, and that outlines the esophagus, tells us whether the repair was okay or whether there was a leak. And hopefully, and as God would have it, everything was fine.
Today is his 7th day post-surgery, and he's currently feeding by mouth, and is tolerating very well and is prepared for discharge. He will be the about the 5th patient that has had this surgery since our inception, and in all of our patients, we offer them minimally invasive surgery, meaning that we don't open their chest. So we use minimal incisions as small as a pen to do the procedure, and we have seen that they tolerate these procedures very well, and they have smooth and uneventful recovery.
So my baby is discharged already. We spent 8 days. So I want to thank Dr. Hara. Firstly, I'm going to thank God, because with God, all things are possible. I've already lost hope, like because of the stress and everything we've passed through in the previous hospitals before they brought us here, or referred us here rather.
It's all about treating these tracheoesophageal fistula patients at right time and right place.
Now, there are so many children that are born with this kind of condition in different places. When a child is born and they try to put a tube, usually which is a normal thing, they try to put a feeding tube through the mouth and it is coiling, it's not going down. It's usually an indication that, look, there may be a problem with this esophagus. You don't need to be worried, you don't need to be troubled. It can be repaired safely. And we've done about 5, and all the patients have gone home. They've done very well. Now, in another 3 months, I can assure you, Disney is going to put on a lot of weight, and it's going to be looking very good.
I want to thank Dr. Arua and his team. God will always protect and guide him too. But also to the nurses for the care, because ever since I've been in this place, they have a good customer relation. They talk to the patients very, very well. They relate with us well. They have a good customer service. So I'm glad at the moment.
We'll continue to see baby Disney as he continues to grow. We'll follow him up and be sure that he's adding weight and tolerating his feeds, and he will continue to follow him up as he grows.